Hi, I'm Dr. Claudia Kim, cosmetic surgeon here at New Look New Life. Today we're going to talk about a condition that's both common and not really talked about, which is inverted nipples, and how surgery can actually correct them. Now, this condition is actually quite common, up to about 10 to 20% of the population. And this topic is important because while nipple inversion is usually harmless, it can impact both confidence and function, especially when it comes to breastfeeding or intimacy. So let's talk about what are inverted nipples. Inverted nipples occur when the nipple points inward instead of projecting outward. And it's actually pulled down by the ducts or these fibrous bands or scar tissue. And it can be mild, where the nipple does occasionally project with some stimulation, or it can be severe where the nipple stays hidden all the time, or you can actually see a hole instead of a protruding nipple. It can be something a person is born with or congenital, or it can develop later in life due to scars from some kind of trauma, infection, breastfeeding changes, or less common but much more serious condition like breast cancer. If the inverted nipple kind of occurs suddenly with associated lumps or nodules, discharge from the nipple, or skin changes around the breast, you need to see your primary care physician or gynecologist immediately. Now, why consider surgery? So most people seek, surgical correction for cosmetic reasons. They simply just don't like the way that their nipples look. Others can actually choose surgery because the inversion makes the breastfeeding much more difficult, where the baby can't latch on, or it leads to repeated irritation or hygiene problems with, kind of just debris being stuck inside the hole of where the nipple is. Regardless of the reason, the good news is that surgery does offer a very highly effective and lasting results. Now let's talk about how the surgery is performed. So the inverted nipple correction is typically performed as a quick outpatient procedure. You can be awake for it with local anesthesia. It takes about 30 to 60 minutes, and it's really tolerable, where some over-the-counter pain medications can really help for the first day or two. Tiny little incision is made at the base of the nipple, and from there we release the tight bands, or like the fibrous bands that are pulling the nipple inward, and you can do some additional techniques which I'll go into. So the main two approaches that we consider when we're doing the surgery is first the duct preserving technique, which means that the goal is to keep the ability to breastfeed. So we actually release the tissues and by spreading them while keeping the actual milk ducts intact. And then you place a supporting suture around the nipple that is really only meant for people with a mild inversion. The second technique, or the duct dividing or duct cutting technique, these are better for more severe cases. And here we actually have to cut the tethering ducts and the fibrous tissue, which decrease the chance of the nipple being pulled down again. The trade-off is that you're going to lose the ability to breastfeed because you're cutting through the milk ducts. Now, the recovery is generally very smooth. Most patients experience like a little swelling or tenderness after the local anesthetic wears off, and for a few days you can take some over-the-counter pain medications, or a little bit stronger if you're more sensitive to pain, and then the area is covered by this protective dressing for a few days, and you can resume your normal activities the next day. But you do have to hold off on exercise for about 2 to 3 weeks, and the final nipple shape and the projection actually becomes stable after a few months. As with any procedure, there are certain risks. The most common are reoccurrence of the inversion, changes in the nipple sensation, or scarring. Less common risks include infection or asymmetry, and really severe complications are rare in healthy individuals. So overall, the satisfaction rates are quite high for this correction surgery. Patients typically report not only a better cosmetic appearance, but also a boost in confidence and comfort. And success rates can be as high as 80 to 90%, depending on the technique used and the severity of the inversion to start with. So in summary, inverted nipple surgery is a safe, effective, and relatively quick procedure that can provide long-lasting results. So whether a patient's motivation is cosmetic or functional or both, this procedure can actually offer a very meaningful improvement in your confidence and quality of life. So I hope you guys get a better understanding of inverted nipples and what can be done to address it, especially since it affects so many individuals. So if you like these educational videos, give me a like and a follow. Till next time.